everyone. So in this video, we are going to talk about group and family therapy, and this is pages 566 to 568. So individual psychotherapy offers a personal relationship between the client and the therapist, and it's focused on one person's problems, thoughts, and emotions. Individual psychotherapy has some limitations that group and family therapy can help overcome. So group therapy involves one or more therapists working with several people simultaneously. Virtually any approach, psychodynamic, client-centered, behavioral, cognitive, any of those can be used in group therapy. Nearly any problem that can be treated in individual therapy can also be treated in group therapy. Now, group therapy has several advantages over individual therapy. Because a single therapist can work simultaneously with several people, it is less expensive for the client and less time-consuming for the therapist. Rather than relying on a client's self-perceptions about how he or she relates to other people, the therapist can actually observe the actual interactions with other people within that group setting. Sometimes the group can serve as kind of a little peek into the client's actual personal life. We can actually see what's going on with the client in his or her life outside of therapy by watching how the person interacts with people in the group. The support and encouragement that are provided by the other group members can help a person feel less alone and understand that other people do struggle with a similar problem. Working within a group gives people an opportunity to try out new behaviors in a safe, supportive environment. For example, someone who is really shy and submissive can actually practice being more assertive and receive honest feedback from the group members. So group therapy is typically conducted by a mental health professional. In contrast, self-help groups and support groups are usually conducted by non-professionals. Self-help groups and support groups have become increasingly popular in the United States and can be very helpful. For example, there are plenty of different support groups or self-help groups that are led by, for example, I happen to know of one that is for people with autoimmune disorders that is led by a nurse. Many branches of AA, they're self-help groups. They're not led by any type of professional. They are led by previous addicts, previous people with addiction issues. So those are all some examples of the self-help groups and the type of people who lead them. It's not someone professional. It's not someone trained to be a counselor or a therapist. It is someone who has the experience in that particular area to help. So now family therapy. Instead of a group of people with a similar problem, family therapy looks at a whole family rather than just an individual. The major goal of family therapy is to alter and improve the ongoing interactions among the family members. So family therapy is based on the assumption that the family is a system, an interdependent unit, and not just a collection of separate individuals. All family members play a unique role, and every family has certain unspoken rules about interaction and communication. Unhealthy patterns of family interaction can be identified and replaced with new rules that promote the psychological health of the family unit. Family therapy is often used to enhance the effectiveness of individual psychotherapy. For example, patients with schizophrenia are less likely to experience relapses when family members become involved in their therapy. Family therapy may also occur when there's, for example, I actually worked with someone he was a domestic violence offender, and in addition to seeing me, because I was his court-ordered therapist, he was also doing family therapy with his wife and his children to work on fixing the issues in the home and to kind of mend fences, so to speak, to be metaphorical, and just try to fix things at home. He was involved in family therapy. In addition to individual therapy with me, he went elsewhere with his family to receive therapy. So many therapists who do family therapy also provide marital or couple therapy. You might have heard it called couples therapy, like the possessive. It's the same thing. I call it couples therapy because it's therapy of couples. So that term couples therapy is preferred today as opposed to the term marriage counseling because this therapy can be conducted with any couple in a committed relationship, whether they're married or not. So they don't use marriage therapy, they don't use marriage counseling because that's an outdated term. People do not need to be married to seek counseling as a couple. So behavioral couples therapy is based on the assumption that couples are satisfied when they experience more reinforcement and punishment in their relationships. It focuses on increasing behaviors and increasing the positive behaviors and teaching couples how to constructively resolve conflicts and to solve issues. Now, most couples therapies have the goal of improving communication, reducing negative communication, and increasing intimacy. So that's a little bit about group therapy, couples therapy, self-help groups, and support groups.